just finished my first round of 88 days. Um, I've got some of my figures on my weight are a little low because this all came in after I started and finished the 555. I didn't get my scale for almost another week.
Well, you can round it up a little bit of what you think you lost, so you
Yeah,
give us
well,
a real number of what you
yeah,
think it
it
was.
reported 28.6 pounds, and actually it was more between 32 and 35. And I'll tell you
Great
why.
job, brother.
I'll tell you why on that here in a little bit. Body water change was 4.3%. Skeletal muscle was 3.9%.
Boom.
Shape shift in inches was a minus 12.64 inches.
Let's go.
Body fat was a minus 6%. Visceral fat was minus 4.
Yes.
BMI was minus 3.5. And metabolic age was down 1. Okay. Um, Now, what one thing that I had my blood work done last Friday, and I had an appointment with my cardiologist yesterday morning. And I went in and weighed in with him on their scale with clothes on, and I weighed at 2.07 in his office. And he was extremely happy because he recorded I had lost 30 pounds. So what he was saying, what I was saying, we were kind of in the same ballpark. Uh, Another one of my shape shifts is that, and I didn't give you a shape shift here somewhere. I'll have to go back and find it. Yeah, I did give you shape shift.
Yeah, we got it, man. Yeah, you lost more than a foot.
Yeah, more than a foot, more than a foot. But uh, I've got 6 inches out of my belt and I'm ready to punch a new hole in that belt. So I'll
Come on.
break it down to 7 inches. My cardiologist was extremely impressed with what I had done. He said, whatever you do, keep on doing it. So I'm going to be going into round 2 here shortly. And he actually wanted some information on this. So I did leave him with some information on some of the supplementation because I told him I was really trying to repair cartilage because I've still got a knee problem and I've got a hip problem, which I'm working on. So my morning cardio event is done on my Reebok spin bike because I really can't get out and walk that much. But that's been going extremely well on the morning rides. So I did when I went into the office with my cardiologist, I was wearing this little gray t-shirt here. So I gave you a little bit of advertisement.
Well, thank you, brother. And listen, I just texted one of my staff. So we have something for anyone when you go on a doctor's visit. Listen, this is one of the biggest steps that we can all take together to build our movement of Energized Health, of teaching people, especially doctors, right? Doctors get to reach thousands of patients.
Yes.
And so we have something just for the doctors that they can, and we're going to put it in the chat. So anyone that, if you're planning a doctor visit, or if you just want to, next time you go to your doctor, just please write this down to say, hey, I'm going to share this with my doctor next time I go in. So some of you may have met some of the doctors already, but we have a whole bunch of doctors who now have become advocates of Energized Health, and they're helping us to take it out to the medical community so they can start prescribing Energized Health. How about that for a prescription?
There you
How
go.
many of us wish we would have gotten that prescription at our doctor? Just give me that prescription, man. With 100% money back guarantee, give me that one. But we got some doctors that, you know what? They are embracing our science because they had a patient just like you, Sid, and they can't deny the result of, hey, this person got way healthier doing whatever they did than taking the medication I told them to take. So I want to check that out.
Yep.
So we do
Okay.
have a special link. If somebody in my staff can get that medical link and put it in the post for everybody. And then actually, let's make sure we have it every week. I'm just talking to my team now. Every week going forward, let's make sure we have the link to share for doctors to go to. so that
Is
everyone can share that. Thank
is
you.
there any place you can put that in the dashboard?
You know what? That's even a better idea, Sid.
If it's
So
in the dashboard where we can go right in and pick it up.
yeah, so team that's listening on here, please put that for your next meeting to see if we can either put it in the dashboard, put it in every week on Tuesdays, or put it Facebook post. Let's put it everywhere we can to really, circle the wagons to help these doctors now that we have all this momentum with the medical. Yeah, we have one guy that's about to connect us with 1,700 doctors, by the way. So imagine how that could change so many thousands of patients' lives when they get that. So thank you, Sid. Thank you for doing that, and thank you for the advertisement. Hey, those of you that haven't won a t-shirt, I'm sure there's a tattoo parlor near you. You could also just get the big tattoo, Energize Health. Just put on, take one for the team. I'm just kidding. I'm just kidding. Don't get a tattoo.
Or they could just go into the shop and they can buy one.
Yeah, or you could just buy one.
Yep, yep.
Well,
Yeah,
Sid,
put that in there.
congratulations, brother. I'm happy for you, man. Great job on
Yep.
everything, and those are fantastic numbers. Super proud of you, brother.
Thank you. I'm going to get ready to go round 2 here shortly.
All right, let's go. And actually, Chelsea just texted it to me. It's just support at energizehealth.com is where a doctor could get all the medical. We can send them all the medical resources that they would need. It's just support at energizehealth.com.